As healthcare across the country changes, so does the importance of family when a loved one returns home from a stay in the hospital. With the help of area patients and their family members, providing input about their recent experiences, Camden Clark has implemented a patient and family-centered care initiative that improves how patients are cared for, both while in the hospital and upon their return home. Janice Midcap is the hospital's Chief Experience Officer and tells us how listening to feedback from patients and their families helped start this new effort to improve patient care.
So when we talk about patient-centered care, we're talking about as we deliver the care, as the patient's going through the hospitalization or the service. But it's actually much bigger and broader than that. It's about partnering with our patients in quality improvement work and in decision-making and in how we design the care and services. So we've established a patient and family-centered care steering committee. And this committee has management staff, but it also has non-management staff. It has bedside nurses, employees from other disciplines in the hospital, physicians, but most importantly, it has patients and family members on the committee. So they're sitting at the table with us. They're bringing their perspective and their insights. They're able to give us suggestions and ideas on how we can best meet their needs. So they're an important part of the planning process going forward on how we're going to improve the patient experience. We don't want to make assumptions about what our patients value most. So we're hearing directly from them so we can make sure we're doing things that will best meet their needs.
In my recent stay in the hospital, I've seen a real nice influence by West Virginia University, the level of care that I received from the nursing staff, from the physician assistants, from the infectious disease team. You could definitely see that there was a shift in emphasis. I like the personal touch I have, but I also, when I expressed some concerns about some things that I experienced in the hospital, that there was a genuine interest in trying to change some of that.
I think it's very important that the patient and the family be included in decision making, in the care of how we want to be treated. We've had excellent care here at Camden Clark. I was born here, my children were born here, my family members have been here, and we have had very, very good care. But through this committee, I can see where we can make a lot of improvements when it comes to families and patients and the care that they receive.
Well, I've been around Camden Clark since I moved here 48 years ago and seen a lot of changes over that. But the reason I was asked to be on the committee is because of my wife's journey for 13 and a half years through cancer treatments. She never wanted to leave town. We never felt like we got shortchanged here.
So traditionally in healthcare, we have done things to patients and we've done things for patients. But when you think about a patient and family-centered care approach, there's a subtle difference where we're doing things with patients. And traditionally, the family often finds themselves like a bystander on the sidelines. But with patient and family-centered care, we're pulling them in and we're involving them more. When you think about it, the family member knows their loved one better than anyone. So they can be a very critical part of the healthcare process to provide important information. And oftentimes when patients go home, they find themselves in a situation where the family member is continuing that care in the home setting. So the more we can involve them and make them part of the process, the better prepared they are to provide that support once they get in the home setting.
When you think about patient and family-centered care, what I tend to think about is the care partnering initiative, involving more of the staff in decision-making. A lot of those things people will feel in the community when they come here. I felt that. So while I was here for the wrong reason, I was ill, the positive side of that is they're genuinely interested in the journey.
I feel like you're treated as a valued customer as opposed to just a patient, and that's changed over the years. And it's gotten much better over the last 5 years and 10 years. There's been a big change there.
Camden Clark is very committed to improving our patients' experience. And because of that, this new position as Chief Experience Officer has been established. And that shows our commitment and dedication to doing the very best we can to meet our patients' needs. The best healing environment for our patients is one where patients, families, and the healthcare providers collaborate and support each other. And in patient and family-centered care, it's really based on relationships and partnerships. And we realize that we are caring for patients at their most vulnerable time. They're often afraid and they're concerned. And we want to look at them not just as a patient or someone with a condition, but we want to look at them as a person, a human being, an individual with needs, concerns that we can care for in a compassionate way and provide the best outcome and experience for them.